Dr. J, welcoming you to the video series on the appearance of the newborn. The first instinctive reaction of any mother is to have a close look at the face and the head of her newborn. Now, don't be alarmed and don't be worried if you find that the head of your baby is not as perfectly rounded as you were expecting it to be. In most cases, following a normal vaginal delivery, the head of the newborn appears elongated, swollen, or sometimes even pointed. Now, you've got to appreciate the fact that the skull is made up of separate bones. And the head of the baby is the first part of the body to present in the birth canal. And the birth canal is a pretty narrow and a pretty congested place. And while the head is pushing down, it exerts a lot of pressure on the head. So these bones tend to come closer together and sometimes overlap while the head is being passed through the birth canal. And this gives rise to the effect on the scalp or the head, which is called the molding effect. Now, this molding is usually transient and temporary and goes away within a few days. On the other hand, babies born out of cesarean sections or a breech delivery, where the feet of the baby present first or the buttocks present first, usually have a very well-rounded and a well-shaped head. Now, there are two kinds of swellings that are often a cause of concern to the mothers. One is called the caput. Caput is a collection of fluid in the scalp. And obviously it is because of the pressure that is exerted on the head in the birth canal. And it's usually found on top of the head or on the back of the head, because those are the two areas which really bear the maximum pressure. This swelling usually goes away in about 4 or 5 days' time. The other kind of swelling, which is usually on one side of the midline, is called a cephalhematoma. And cephalhematoma is actually a collection of blood between the skull and the scalp. And again, it's because of pressure that's exerted on the head. This swelling takes time. It takes up to a few weeks, even 3 or 4 weeks to go away. In any case, both these swellings are external swellings and have nothing to do with the baby's brain. There is no specific treatment for it. All you have to do is just wait and relax, and the swelling goes away with time. The other cause of concern which I find with many new mothers is the soft spot or the fontanelle of the baby. Now, usually babies have two soft spots, one on the top of the head, which is called the anterior fontanelle, and one on the back of the head that's called the posterior fontanelle. The anterior fontanelle is anywhere between 1 to 3 inches in width. And it is because of these bones, the different bones of the head, of the skull, they are separated. And they do not fuse right away after birth, because imagine if they were to fuse right away after birth, where would the brain go? How would the brain grow? So to compensate for the growth of the brain, these bones are separated and opened. And the soft spot or the fontanelle closes any time between 12 to 18 months. A lot of young mothers are very scared to touch the soft spot. No, there's nothing to worry. It's pretty strong. And sometimes you will find it pulsating or even slight bulge when the baby cries or when the baby laughs a lot or the baby is moving a lot. So these fontanelles are very important and they must remain open. Premature closure of the fontanelles is a cause for concern to medical doctors. So in this particular video, we talked of the head, and I'll be seeing you in the next video soon. Thank you for watching and stay with me.